Hello class, this is going to be the first video for special tests. So what you will need is your competition specifics paper or your document. You can have your computer next to you if you want to take notes on that Google Doc that I shared. And I want you to scroll down to the special tests. So we're going to start to practice special tests at home. So after you have your competition specifics out, you're going to read the first two under foot and ankle. So the first one is going to be the anterior drawer, and it says ATF ligament after. So ATF stands for anterior talofibular ligament. Okay, so that is what we are testing, the structure we're testing when we do this test. So after you have that ready, you are going to grab a partner. You should have somebody at home. I don't have anybody here with me except for my kind of little skeleton over there, but I'm going to use this for reference. Okay, so this is like my little anatomical model. So first, what I want you to do for the anterior drawer special test of the ankle, you're going to lay down your subject. Okay, it could be on a table, it could be on a bed, and then you're going to have them lay down with their feet slightly off. Okay, so their ankles are kind of slightly off the table. Once they are slightly off, you're going to perform the test. So you have them relax their foot first. You stabilize the lower leg. Okay, so you can kind of pin it down here on the table. You're going to grab the bottom of the foot with your other hand. Okay, and then you can grab part of the heel as well. And then you're going to slightly, so if they are relaxed, their foot should be slightly plantar flex. Okay, and then you're going to pull in a kind of diagonal direction. Okay, we're going to test that ATF ligament, so this is what it looks like. Stabilize, grab the foot, part of the heel, and then you pull in that diagonal direction. So you should see a little bit of movement. Okay, I'm pulling that foot upward and diagonally. So what that tests is the anterior talofibular ligament. Anterior being in the front. Talo has to do with the talus, so this bone here, right under the tibia, and then fibular has to do with the fibula. So anterior talofibular ligament. So it connects right here. When we do this test, we are trying to stretch that ligament out to see if it is compromised. Okay. Next test we're going to do is the inversion Talar tilt test. Okay, so inversion Talar tilt test, you're going to have your subject in the same position, okay, on the table. You are going to stabilize their lower leg, and then you're going to grab the foot. Make sure the foot is kind of relaxed. You can do it either at 90 degrees or slightly plantar flex. Okay, I like to do it in both positions. Okay, so if we're at 90 degrees, what I'm going to do is perform inversion. So I'm going to do the movement of inversion for them. Okay, so I'm going to move the bottom of the foot inward or medially. Okay, and then I'm also going to do it slightly plantar flex. Okay, so this is what it should look like up close. So if I'm right here, I'm grabbing the foot, and then I'm inverting the foot. So the sole of the foot goes inward or medially. And this tests the calcaneofibular ligament. Calcaneofibular ligament would go from the calcaneus to the fibula right here. And if we do the test, that's going to separate those. So if the ligament is compromised, this test will hurt the person, or there will be excessive translation, okay, excessive movement, most likely with pain. Okay, so that is the inversion Talar tilt test for the calcaneofibular ligament.